This blog will be actually similar to the other blog or podcast I just did on how to achieve natural results for the face, in which I did reference briefly some concepts about the hair. But I really want to focus on this particular blog or podcast on how to achieve natural results in hair transplant or hair transplantation. A big thing with this is people think they actually see fake results all the time and it drives them crazy. I will tell you that you probably miss a good percentage of those results that look unnatural. I always say that my standard is far higher than yours because I do this for a living. In fact, what's interesting is I've been working with Amina now, who is my hair transplant coordinator, for close to 20 years. Interestingly, it took me the first few years to actually begin to see the natural results that Amina spotted almost immediately, because she's been doing it for about 10 years more than I have been. And we've been together, as I said, close to 20 years. And so it takes years to begin to see unnatural results. Now, I'm not talking about this horrible hair piece from the 1970s. I'm not talking about the huge plugs or doll's hair that sits up there. I think anyone can tell that looks fake from a mile away. But I'm talking about very subtle differences that just don't look right. So I'm going to sort of break down for you certain things that are there that for me are red flags that look unnatural. So the first thing I'm going to talk about is the lid effect. The lid effect is essentially when the hairline does not match the temporal area. So I was just mentioning in my other podcast for the face that I just saw a gentleman, his profile picture on Facebook this morning, and it just blew my mind because I could see that the facelift he had done actually lost all his temporal hair. Now, I saw some slight recession in his hairline. I could tell that was a natural hairline, but there's two ways that there's that level of recession in the temporal area. One is a hairpiece that doesn't match the temporal point, or a bad facelift where the hair has been removed from the temporal area. And based on what I saw, it was clearly a facelift that just took all his hair away, which the best way to restore that is just to basically do a transplant into the temporal area and the sideburn to balance it. So the degree of recession of the temple should match the degree of recession of the hairline. So whenever you build the hairline too far anteriorly and not support the temporal area, that's one red flag that the hairline is not natural. So that's sort of the macro hairline, which is the hairline position. Another thing is when I teach my course in St. Louis is the hairline shape. So from a frontal view, if the hairline extends beyond the lateral canthus is the outer part of the eye, that it does not look natural. If you think about what a comb over is, it's actually the reverse. It's taking these hair-bearing tissue, the temporal hair, and sweeping it into the central area. The reason that looks fake is that there should be no hair going from the temporal area, which is outside of the outer part of the eye, moving to the middle. That's just a red flag that is a comb over. That's how we know it's a comb over versus a natural part. So if you design a hairline where the outer extent of the hairline is beyond that lateral canthus or the lateral part of the outer part of the eye, then that is another red flag. The other thing that I see in my students when I teach them hairline design is from the side view, if the hairline tilts downward, it just looks totally fake. It looks like a female hairline. So the hairline from a side view has to be flat to the ground, or it has to be tilting upwards for a slight degree of more conservative design. So again, that's something that people don't think about. Now, there's a million other things that are part of the macro hairline. Let's talk about the micro hairline. So the micro hairline involves how the actual grafts look like. So if the grafts are too large for the frontal hairline, that's a problem. We select not only just one hair grafts, but the finest of the fine one hair grafts that are scattered in looking like a coastline. In other words, it's not a straight line, but a natural undulating hairline. So I sit there and fuss and make sure those angles, the way that the hairline is designed is not a straight line. I also work to make sure there's enough sentinel hairs. Those are the hairs that stand out as guard hairs that stick in front of the hairline that further softens it. I also make sure there's enough one hair grafts, as I said, so the hairline does not look abrupt or thick on the frontal area. and that's very, very important. The angles of the hairline can look surprised, meaning the hairs are perpendicularly placed to the scalp. That looks totally fake. And these are not even talking about plugs. I'm not even talking about plugs because I don't think many people do plugs anymore, which are the large 4mm grafts. But I'm talking about modern day current follicular unit transplantation, whether you use FUE or FUT harvesting, doesn't matter. I'm really talking about these micro components that make a hairline look natural. So the angulation looking that angles downward is so important, that are very close to the scalp level, not shooting straight up. Also, if the hairs are splayed open, like a book leaf opened up, that does not look natural, nor does it provide adequate density to the center. You want to provide enough frontal density, but if you make so much frontal density that it doesn't fit a Norwood pattern, that would also be something that looks unnatural. I call that a front-heavy transplant, where you're putting so much weight to the front that the back portion, it looks like it's tilting forward. That also doesn't look natural. And that's something, again, you may not even notice if you don't have the skilled eyes, but I would be driven crazy if I were at a cocktail party looking at someone's hairline because there's too much weight to the front and not enough farther back to create balance. Now, there are a lot of things that go beyond what a surgeon is doing, and we think if you just pick the best surgeon in the world, that nothing else matters. The assistants are not that important, but that's absolutely false. The graft placement, which is done by the assistants, is so critical. Some examples I show on my website are, if you look at the corrective side of my website on hairtx.com, hairtx.com, you will also see that if the grafts are mangled during insertion, they will come out and grow like pubic hair, or there'll be poor growth of those hairs. If the 2-hair grafts are placed in the front scalp, that will be wrong. Even if I design for 1-hair sites, if my staff places incorrectly, will be a problem. If they piggyback the grafts, they'll create cysts, and that will be a problem. The hair has a natural curl. If the curl is not respected and the curl is reversed, placed aiming backwards, that will also look unnatural. If the hairs are not fit into the site correctly, you can get what's called compression, where the large graft sits into a very small site, and then the hairs look like a tuft, almost looks like a plug, even though it's not the old 16 to 20 hair grafts. It could be only 3-hair grafts, but those grafts look compressed. They don't fit right into the site. So before I make 2,000 sites or 3,000 sites, I always test the first few sites to make sure that they fit well. In addition, you can have what's called cobblestoning if the grafts are placed too superficial to the surrounding epidermis. If they're placed too deep, you get pitting. So there's so many of these little nuances. People think, the question is, how many grafts are you going to give me, doc? I get the fact that it's important. And as I talked about in my last podcast about the cascade effect, leveraging that density is important. But how do you achieve natural results? I could spend hours on this. I've only spent 8 minutes talking about it so far, but I will tell you that there's so many factors toward naturalness that you can't even begin to conceptualize. I've only scratched the surface, and I've given you a laundry list of things very quickly because for me to sit here and go through every single way that something could go wrong on a hair transplant would literally take me hours. So I hope you come to us. We do beautiful natural results. I'm going to talk about a lot of different topics in this podcast, but of course, the most important thing is not visual density. It's how do you get a natural result? And of course, visual density has also been covered in my last podcast on cascade effect. So come to see us in Plano, Texas, just north of Dallas, Texas. We look forward to seeing you.